Hi everyone, I'm Anu Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, we'll be talking about blocked tubes and what options are there to help treat blocked tubes. So let's talk about that today. First, why is the fallopian tube important? So going back to how pregnancy happens, the egg is growing and maturing in the ovary, and then it will eventually release from the ovary in a process called ovulation. The egg will then travel down the fallopian tube. Ideally, intercourse will happen around the same time, and the sperm will travel through the vagina, cervix, uterus, and then the egg and sperm actually will meet in the fallopian tube, and that's where fertilization occurs. So if the tubes are blocked, then the egg and sperm cannot meet and a pregnancy cannot occur. Patients with blocked tubes are at increased risk for having ectopic pregnancies. These are pregnancies that can develop in the fallopian tube and a pregnancy cannot survive there. And patients are also at risk for having a lower chance of pregnancy. Things that can cause blocked tubes are, number one, infections. So that could be history of sexually transmitted infections. Gonorrhea and chlamydia are the more common ones, or it could be a history of a ruptured appendix. The appendix being ruptured can introduce infection into the abdomen, and then that can put the tubes at risk. Another cause is endometriosis that can cause adhesions that can damage the tubes. And the last common cause is going to be if a patient has history of multiple abdominal and pelvic surgeries, because any surgery, there is going to be risk for adhesions, and then that could potentially damage the fallopian tubes. Whether or not we recommend surgery will depend on where the blockage is and how severe the blockage is. So there are a few types of blockages. The first is what's called a proximal tubal occlusion. This is a blockage at the beginning part of the tube where the tube meets the uterus. Sometimes this can be due to a true occlusion, or sometimes it can be due to a spasm, basically a contraction of the muscles surrounding that area when we do the HSG, and it can look like an occlusion during that procedure. So one option is to do a hysteroscopy, which is a minor surgical procedure where we introduce a telescope instrument and it'll go into the cervix and in the uterus, and then we'll introduce a little cannula or catheter into the opening of the tube. Now, if the tube is truly blocked there, then advancing the catheter may not be successful. If there is a spasm or some other type of blockage, for example, mucus or debris, then sometimes we're able to advance the catheter through and kind of reopen up that blockage. So it just depends on the type of blockage that it's occurring. The next type of tubal blockage is when patients have had a previous history of a bilateral tubal ligation, because then the tubes were previously ligated. In these cases, depending on the situation, sometimes a tubal reversal is an option where we will basically remove the area of the tube that was previously ligated and reanastomose the remaining edges of the tube. Reanastomose meaning to resuture the remaining parts of the tube back together. The last type of blockage is a distal occlusion, and this is an occlusion of the tube at the distant end nearest where the ovary is. Depending on how severe the blockage will determine the type of treatment that we can offer. So if there are only mild adhesions, it's a mild blockage, sometimes we can open that up and remove the adhesions. So surgery could be an option in that case. If the tube is very damaged and is blocked at its distant end and the remaining part of the tube is dilated and abnormal, that is called a HYDROSALPINX, and that's your most severe form of the distal blockage. In that case, the fluid that can accumulate in the tube can backtrack into the uterus, and it can be toxic to an embryo. It could flush out an embryo. It can basically decrease pregnancy rates. So whenever we find these type of tubes, the recommendation is actually to remove that tube. There were studies done that looked at patients with HYDROSALPINX, and some of them underwent IVF and some underwent surgery to remove the tube and then IVF. The group that had surgery to remove the tube and IVF had a 50% higher success rate with pregnancy. So that is why we usually recommend removing the tube when the damage of the fallopian tube is severe. Any tubal surgery can put patients at increased risk for ectopic pregnancy or a pregnancy in the fallopian tube. So if you've had a history of a tubal surgery or if you've had a history of an ectopic pregnancy, it's important to see your healthcare provider as soon as you think that you're pregnant, as soon as you miss a period, for example. The reason is that an ectopic pregnancy, if left untreated, can grow and grow and grow in the tube, and it cannot survive there. And the thing that we're concerned about is the risk for rupture. And what can occur is then internal bleeding in the abdomen, and the worst case scenarios can be life-threatening. So if you think you're pregnant and you have this history, it's important to see your healthcare provider right away. Symptoms that can be associated with ectopic pregnancies are irregular vaginal bleeding and abdominal pain. So these are also good things to be aware of and on the lookout for if you have that history. When deciding if surgery or fertility treatments such as IVF are right for each individual patient, there are other things to consider. For example, the woman's age and her ovarian reserve. For example, the sperm. If the sperm count is low, then reversing the tubes may not make sense. If the patient has had multiple pelvic surgeries or has severe endometriosis, there's going to be a higher chance of the tubal surgery being unsuccessful. So these are all important considerations when we make the decision. To decide what's best for you, please see your healthcare provider so they can review all of your history and determine what would be best in your particular scenario. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.